Hi, my name is Onyemwen. I'm going to be performing dressing change using sterile technique skills. So I'm wearing the school proper uniform. This is my school badge, and no jewelries, no polish, no nails. So my supplies for those kits are, I have my clean gloves right here. I have my um, sterile dressing kit right here. So I have the wound right here with the bandage on it, and this is my hand sanitizer, and this is my Bowser bag. So next I'm going to apply hand hygiene. So I'm going to introduce myself to the patient. Hi, my name is Onyemwe. Can you tell me your name and date of birth? So I'm going to verify the patient name and date of birth on the wristband. Okay, so I have to ensure I have the right patient. Okay. Hi, like I said, my name is Onyemwe. So what I'm gonna do today, I'm gonna do sterile dressing, changing wound. So what I'm gonna do, I'm gonna take out the old bandage. So I'm gonna take a look at it. I'm gonna clean it, then apply a new bandage. Is that okay? All right. So two things before I start. Please do not touch your wound and do not touch any sterile supplies right here, okay? Do you have any question for me? Okay, all right, so let's start. So I'm going to apply my clean gloves. Okay, so this is the wound. The bandage right here, so I use it to practice, so I just replace it there. Okay, so when removing the bandage, so I'm gonna make sure I remove the bandage parallel to the wound. So I'm gonna press the skin down. So before I do that, I'm gonna move my camera close to me. So I'm gonna press the skin down. I'm gonna pull it up. So I'm gonna pull it back. Okay, put this on the track. Okay, so now I'm gonna inspect the wound. So I'm gonna inspect for any color change, any tissue present like sinus infection, and also I'm gonna assess for any odor, and I'm gonna palpate to check palpate to check for any edema around. I'm gonna palpate around the wound to check for any edema, any drainage, and any pain if the patient have pain. So okay, all right, okay, so I'm done with the assessment. So now I'm gonna take out my gloves to proceed to the sterile part. Put it on the Bowser bag. Okay, so now I'm gonna perform hand hygiene. Okay, so this is my sterile dressing kit. So it's open because I use it to practice. That's why it's open. So normally usually sealed up. So when opening the sterile kit, so I'm gonna open it from the top right here. So I'm gonna open it from the top right here gently, like this. Open it gently. Then from the top right here, open it gently. So now I'm gonna flip. Put this under the. Okay. So now I'm gonna use my 2 fingers to take out the sterile gloves. Okay. Put it on the table. So I'm gonna open this from here. This is the only part I can touch. I can't touch inside. So this is the only part I can touch right here. This is 1 inch, is the only part I can touch, so I can touch this area. So I'm gonna use my 2 fingers to grab the gloves. Put my 4 finger inside, gently. So I'm gonna put my 4 finger right here to pick up the gloves. Okay, so I'm gonna put my 4 finger inside gently. Okay, so now this is gonna be my clean hand and this is gonna be my dirty hand, because I'm gonna be using this on the wound. So I'm gonna pick up the swab, drop it on my hand. Okay, so now I'm gonna clean 1 past 1 inside the wound. And then like making a circle. So I'm gonna put this in the biohazard bag to grab another one. So because I don't have another one, so I'm gonna use it to clean the outside of the wound. I'm gonna dump this on the biohazard bag. Okay, so now I'm gonna get the gauze, dump it here. I'm gonna pat dry inside of the wound. I'm gonna put on the biohazard bag. So I'm gonna get the gauze again and dump it here. So I'm gonna clean the outside of the wound, the edge of the wound, the outside. So I'm gonna put it on the biohazard waste can. So now, I'm gonna inspect over again, because now it's more visible for me to see. So I'm gonna inspect for any like I did before, any color change, any tissue present, and any odor, and I'm gonna palpate, because I'm palpating like the way I did it before. Okay, all right. So now I'm gonna get my the Tegaderm. So at this time, I'm gonna use my 2 hands. So I'm gonna open it from here. Okay, so I'm gonna put this in the biohazard bag. So I'm gonna apply this on the wound. Okay. Okay. So this white stuff, the white molded around it. So in real life, I would take it off, but in this video, I'm gonna leave it just in case any remediation. So I'm gonna leave it. So I'm not gonna take it off. But in real life, I have to take the white stuff around it. I have to take it off. Okay, so now I'm done with that. So now I'm gonna pack up my stuff and put on the bowl as a trash. Grab it here. Put it on the bowl as a trash properly. So now I'm gonna take out my gloves. I'm gonna grab here. I'm gonna fold it. Put my 2 fingers under the gloves right here. I'm gonna put it in my bowl as a bag. Okay, so at this time I'm gonna get my Shaprio. I'm gonna write my initial time and date, but I'm not gonna do it on this video. But in real life, I have to do it. Okay, so I'm gonna perform hygiene. So now I'm gonna make sure that my patient is comfortable, is not laying on anything. If you need the then I'm gonna give him my patient the call light. So if the so now I'm gonna exit the patient room. So if the patient want the door open, I will leave it open. If you want the door closed, then I will leave it closed. So I'm gonna exit the patient room to go document my results.